So from below the umbilicus along the midclavicular line. Rosita, can you please take a deep breath and hold? Okay, can you relax? Mark it now. Okay, so from below the inferior border of the breast, okay, I will have to go a little lower. Take a deep breath again and hold. Okay, and then we so we said this is about 6 to 12, a little less than 6 because we have to start a little higher. Okay, so about 6 to 12 centimeters. Okay. And then along the mid-sternal line, we do the same thing. Okay. Deep breath, hold. Okay, relax. Now from below the xiphoid, I will start a little lower again. Okay, relax. Measure. And that's about 4 to 8 centimeters. Okay, so this is for our liver span. Now, we do our splenic dullness, and we said for the splenic dullness, our landmark will be the 9th to 11th intercostal space left mid-axillary line. Okay, so your last intercostal space will be the 11th. Okay, so just feel for, oops, okay. Okay, feel for the two intercostal spaces above it. Okay. No, straighten your body. No, keep your body straight. There you go. I cannot reach you. Thank you. Okay, so you percuss. Okay, you will hear some area of some dullness here. Okay, move down. The area of dullness will extend all the way to the 11th. From the 9th, you also try to percuss upwards to see if there is any, dullness above the 9th, which will mean that there is an enlarged spleen. Okay. Now, let's say there was some, I think there's some enlarged spleen. We will now be doing the Castell's sign. So this time along the anterior axillary line, the 11th ICS. Okay. So that is the sound that it's making, more tympanic. Okay, now take a deep breath. Is there a change in the tone? None. Good. Relax. Okay, so when the patient takes a deep breath, you do not expect to hear a change in the tone. If the spleen were enlarged, then you would hear an area of dullness. Okay. Now we do our blunt percussion. So from just below the right costal margin. Any pain? Okay. You mind sitting up? Okay. Now below the posterior ribs. Okay. Just the flank area, as we call it, or the costovertebral area. Any pain? Any pain? Okay. Now you can lie down again. Now, we do our assessment of the, we do our light and deep palpation. So for the light and deep palpation, again, we follow that systematic diagram. Okay. So we use both our hands. So initially we do light and then deep, but we combine it. So you don't need to come back again to touch your patient. Now we always keep in mind, if in the history your patient says, I have pain here, that's the last area that you will be palpating. Okay. So your dominant hand will be in contact with the patient's skin. Okay. Light and deep. Any pain? Light and deep. Any pain? Tell me if there's any pain. The stomach is dead. Sorry. Just one. I want to emphasize to them that it's deep palpation. When you have light palpation, how much of the skin do you depress? Light.
1 centimeters.
Less
No,
than
light.
one.
Light is less than
Oh.
Less than 1 centimeters. And if you have deep palpation,
1 to 2 inches.
1 to 2 inches. Good. Okay. So that's why it's important when we do the examination of the abdomen, the patient's bladder should be emptied. You do not want to be palpating and then, oops. Okay, patient leaks. Okay, now, we do our, so no tenderness, there was no muscle guarding, the abdomen was soft. Okay, now we do our liver border. So this is for the bimanual, one of the bimanual palpation techniques. Okay, put your hand on the posterior between ribs 10, 11 and 12, I should say. Okay, push up. Okay, now feel the costal margin, right costal margin. Take a deep breath. Okay, feel. I do not feel her liver border. Okay, relax. Okay, any pain?
No.
Okay. Now for the spleen, again, this time on the left. It's fine, you might fall. Okay, push up. This time your palpating hand will follow the direction of the left costal margin. Take a deep breath. Okay, it's not palpable, that's normal. Now for the kidneys, left. Okay, push up again. Okay, feel just a little below the right, the horizontal line. Okay, can you please take a deep breath? Okay, good. So palpable. And then on the right side, take a deep breath. Okay, not palpable. So kidneys, spleen, the liver, the border, it's not palpable. Okay, next. We now do our special tests. So the first one will be the daily measurement of the abdominal girth. So you take your tape measure. We always use the umbilicus as our landmark. Okay. Now it is best to take the measurement every day at the same time, and it is always recommended that if you did it yesterday, you might as well do it today, so that you do not, you're not going to miss the spot wherein you go a little too high or a little too low. Okay. Now for the fluid wave test, like I said, these tests you will be able to appreciate if the peritoneal or the ascitic fluid is 500 ml or higher. Okay, so we ask the patient, can I borrow your hand? Put it in between, this way. Okay, like this. Okay, now put one of your hands on one flank, the other, use it to tap. Okay, now if there was fluid, when you tap this, the fluid will be felt all the way here. Okay, fluid will be felt all the way here. Okay, one of my students, he said, because he had a very protuberant abdomen, he was saying, Dr. E, see, it's jiggling. I know it's jiggling, but even if you tap it really strong, you will see the jiggle here. It will not extend all the way here. Okay, so that is the fluid wave test. Now, for the shifting dullness, let's say your patient has ascites. When the patient is lying supine, where do you think the air fluid level is? I'm sorry, where?
To the back.
It's going, you see the fluid will be
On the sides.
gravitating to the sides, right? Okay, so when I do a percussion, the change in the tone will be felt towards the flank area. You will feel it here, and you heard it here. Okay, the fluid would have gravitated to the side. The air fluid level, the air is from the rest of the abdominal structures. Fluid will be here. Okay, now I will ask the patient, can you please turn to your right? Now, what do you think will happen to the fluid?
Turn to the right.
It will now gravitate to this dependent side. So most of the fluid will be here. Sometimes the air fluid level may now be very close to the umbilicus, right? Because the fluid will all be gravitating here. There will be a lot less on this area which is, not or away from the site of gravitation. So when I percuss, the air fluid level will be felt closer to the umbilicus. So I will put it here. So you can let down again straight. Thank you. So this is the shifting fluid dullness. Initially, patient lying supine, closer to the flank. When the patient turns to one side, it will be now closer to the umbilicus, okay, because of the gravitational change. Okay, next. We also have the special tests for appendicitis. So what do you call this area here? The right lower quadrant where the appendix is located?
Bernie's point.
McBurney's point. So if the patient says, I have pain here, we do our Blumberg's sign. Okay, we gently palpate. Okay, but it's when you lift your finger, that's when the patient says,
Ouch.
ouch, and that's going to be felt on the right lower quadrant. Now for the Rov Sings, I will palpate on the left. Okay, but the patient will feel the pain over on the right lower quadrant. Okay, now for the psoas, Rosita, can you please raise your right leg, just the right? Okay, and then try to resist, try to push against my hand. I will try to push down the leg, and the patient will again feel pain on the right lower quadrant because of the pull of the muscle. Okay, now for the obturator, can you please bend your right knee? Okay, and then I will now, just the right. I will now push the knee. Let go. I'm not going to remove it from your hip socket. Okay, so knee bent, in and out. And again, patient will feel pain over by the right lower quadrant. Okay, and then lastly, okay, wait, I need the.
Oh, you need it.
Okay, for Murphy's sign, inflamed gallbladder. So, like curl your fingers around the, around the costal margin. Do it like this. Okay, and then ask the patient, take a deep breath, push deeper. Okay, and again, when the patient takes a deep breath, it will push the gallbladder closer to the anterior surface. It will touch the tip of your examining finger, and you, on the other hand, will dig a little deeper. Okay, so the patient go, ouch. Okay, so that's a positive Murphy's sign. Okay, and lastly, you have the asterexis. Can you please raise your arms and dorsiflex the wrist? Okay, for about 15-20 seconds, observing for any movement. So normally, you will not see any movement. In hepatic NSF, there will now be the flapping movement, okay, because of the disruption of the motor tracts. Okay, so this is for the abdomen questions. None? Okay, thank you.